In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. Thousands more are fighting for their lives in hospitals. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
The latest strand of coronavirus, known as COVID-19, was first reported in the commercial city of Wuhan in faraway China, more than 9,920 kilometers away from Lagos, the first place to record a COVID-19 case in Nigeria. From Wuhan, the virus traveled around the world at light speed and leaving behind trails of devastating consequences. In no time, the virus was declared a pandemic even before it found its way to Lagos, Nigeria.
So the gentleman who came here apparently may have gotten infected at a point, but walked through the scene, the screening, with no symptoms. And by the time he got to his house, I think a day or two after, he started to feel unwell. And wisely enough, he went to a hospital.
Like an angry raging wildfire, burning almost everything on its path, the pandemic imprinted catastrophic effect on every aspect of Nigeria's socio-economic life. Most Nigerians perceive coronavirus first as an economic crisis before a health risk. And this is not surprising, with a negative turnaround that the country's economy could contract by 3.2% from a positive forecast of growing by 2.1% in 2020. As the virus raged, Nigeria closed its land borders and airspace, went into a mandatory confinement, and did little or nothing to stem the spread of the virus. With sharp drop in crude oil prices and drop in revenue generation, Nigeria faces daunting obstacles to finance its budget. With closing of the airspace, airlines have lost over 180 billion naira and 91,000 jobs expected to be lost in the same sector.
The disaster facing the airline industry is much bigger. I would say it is bigger post-COVID than any other industry at all. Because if the airline industry is tied to economic growth of any nation, post-COVID economic collapse and challenge of the industry can best be imagined. With 1 million aircraft on ground all over the world, the Nigerian airlines, as weak as we claim they are, if they are down for another 6 months, it's going to be a very major disaster.
As the lockdown continued to bite hard on medium and small-scale enterprises, employers laid off staff or cut staff salary by up to 50%. Schools remained closed for all cadres of classes, thereby disrupting the academic calendar and putting in great doubt whether Nigerian students will sit for 2020 WAEC examinations. Nigeria's health sector, which even before now had been plagued with dilapidated health infrastructures or lack of it thereof, had been overstretched beyond its capacity.
When COVID-19 came, we thought we were ready, but you and I can see now that we're not ready. You know, our level of preparedness and response clearly will actually require a lot of, in fact, it's getting, the truth is that COVID-19 has actually shown Nigeria as having a very weak health system. That is the truth.
It is projected that additional 7 million Nigerians will fall into the poverty bracket by the time the pandemic is over, and unemployment may shoot over 35%. In the midst of all that, incidences of rape and other sexual-related offenses cases were also on the rise. Between January and May 2020, over 717 rape cases were reported in Nigeria.
One of those conclusions that we are making now is the fact that the lockdown, of course, has necessitated perpetrators to be within the same confine, within the same space as the survivors, as the people who are being raped, with the women and the girls. So the women and the girls are helpless. The perpetrator also knows that the women and girls are helpless at this time.
Despite federal government's repeated assurances that the country was ready for the eventualities of the virus in Nigeria, the country was caught unawares when the first case of the virus was reported in Lagos on February 28, 2020. This was besides the case of an Indian working at Dangote refinery in Ibeju, Lekki area of Lagos, who was alleged to have come into the country with the virus undetected. These incidences betrayed government's earlier assurances of preparedness. In an effort to contain the spread of the virus, President Muhammadu Buhari on March 30th declared a total lockdown in 2 states of the Federation, Lagos, Ogun, and the FCT Abuja, where the virus was more pronounced.
Based on the advice of the Federal Ministry of Health and NCDC, I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days with effect from 11 p.m. on Monday, 30th March 2020. This restriction will also apply to Ogun State due to its close proximity to Lagos and the high traffic between the 2 states. All citizens in these areas are to stay in their homes.
The lockdown was more a knee-jerk reaction than a deliberate and well-thought-out policy by the government of Nigeria. In order to cushion the severe effect of the lockdown, the president ordered the immediate disbursement of financial aid of 20,000 naira as palliative to the most poor and the vulnerable. The palliative created more concerns and questions than it created succor and relief for which it was intended. The Central Bank of Nigeria provided a 50 billion naira stimulus package to firms to help support them stay afloat. In addition, the CBN also provided a 3 million credit facility to families impacted by the COVID-19 pandemic.
Of its financial system stability mandate, the Central Bank of Nigeria is committed to providing support for affected households, businesses, regulated financial institutions, and other stakeholders in order to cushion the adverse economic consequences of this pandemic on our people. Creation of a targeted credit facility. The CBN hereby establishes a facility through National Microfinance Bank to the sum of about 50 billion naira for households and micro, small and medium enterprise-sized enterprises that have been particularly hit by COVID-19, including but not limited to hoteliers, airline service providers, healthcare merchants, and etc.
Meanwhile, the Bankers Committee pledged to provide 3.5 trillion in support to pharmaceutical companies, assist essential health companies in purchasing raw materials, and encouraging local production of goods. The health sector, which before now had largely been ignored, saw huge investments in providing medical equipment and other infrastructure. According to the Nigerian Medical Association President, Professor Innocent Uja, before the pandemic, Nigeria has just 3 PCR machines, but now the country has about 33 PCR machines. PCR machines are essential to determine and detect the coronavirus.
Even then, the equipment are not there. You can see that when we started, I think the PCR machines that we had in Nigeria, at the time, that was by the 27th of February, when the first case of coronavirus was reported in Nigeria. We didn't have up to 5 PCR machines. But today, there's some improvement. We have about 33, I think, or more. That's an improvement.
The federal government also moved to stem mass sacking of employees by formulating a policy promising 50% tax refund to companies who do not lay off staff during the pandemic. The House of Representatives passed the Emergency Economic Stimulus Bill 2020 on March 24th to provide support to businesses and individual citizens of Nigeria. The law's aim is to provide 50% tax rebate to businesses that are registered under the Company and Allied Matters Act, so they can use the savings to continue employing their current workers. The federal government rallied around the private sector to raise $330 million in donations to be able to tackle the pandemic. The government also approached the International Monetary Fund to borrow $3.4 billion as an emergency support to Nigeria to tackle the economic impact of the pandemic. According to the World Bank, the shock of COVID-19 will likely push 5 million Nigerians into poverty by the end of the pandemic. Before the pandemic, the number of poor Nigerians was expected to increase by about 2 million, largely due to population growth. The number would now increase by 7 million, with the poverty rate projected to rise 40.1% in 2019 to 40.5% in 2020. According to experts, Nigeria will likely face its worst recession in 25 years, as the country's economic growth is also expected to contract by 3.2% and might contract further if the pandemic is not curtailed by the end of the third quarter of 2020. As a positive consequence of COVID-19, Nigeria is expected to improve investment in its healthcare and will be likely better prepared for future disease outbreaks.